Hey, it's Dr. Denke. I am a certified chiropractic sports practitioner and near Houston, Texas. And today we're bringing you some great information about upper back and neck pain. We like to serve healthy young individuals who are just trying to get out of pain, help them with movement, soft tissue, and just help them maintain a happy and healthy and functional life. You can find me on Instagram actually at Select Body Doc. And I'm also here with Dr. J, who's going to tell you a little bit about himself as well.
Yep. So I'm Dr. J. I'm a physical therapist. I'm also a fitness coach. So basically what I do is I provide services online. And mainly, I know I'm just trying to help people live out a better quality of life, move better. And we also even target things like your nutrition. But mainly, it is about getting pain relief. And that's where, me and Dr. Joe Denke, we're able to help you guys out. So, so I think, what we are trying to do today is kind of go through specifically people that are, sitting at the desk that might have some like neck and upper back pain. We're going to be explaining certain things that you should be looking out for, certain interventions and exercises that you can do for yourself in order to get pain relief. So hopefully this will be a very, very, informative thing for all you guys. And you can find me at Flex with Dr. J, on my Instagram as well.
Awesome. So since obviously we're all stuck at home right now, and there's still a lot of people that are dealing with upper back and neck pain. We obviously know that these things don't go away just because you're at home. And as a matter of fact, people may actually be experiencing more upper back and neck pain because now we're stuck more on the social media, the technology, the computers, the laptops, working from home. So why do you think it's important for people to take care of these issues now so that they don't become a bigger issue later?
So I always talk about, the two paths, right? So some people, any chronic pain is pain designated by longer than 3 months to, even to years. So you can go down two paths, and it's really up to you which path you want to go down, right? So, you're sitting a lot at work, and you're maybe at a computer, and a lot of times you want to go home and you want to de-stress. So you're like sitting on the couch, but now we're stuck at home, but some of that pain has kind of come back with you, right? You're not. So the thing is, what you can do with your time currently is being able to utilize that time to do things such as stretching, mobility exercises, and it's really up to you which cycle you want to go down, right? You can go down this path where you're sitting even more at home and you're even more sedentary. And what can happen is a lot of these neck and upper back issues can become even more apparent, right? Or you can go down this path where you have more time. Obviously, there is a very stressful environment, but you have all this time for you now in order to prioritize your health, in order to make sure that you're doing all the things that me and Dr. Joe are going to tell you. And, so you can go down these two paths. It's just a matter of like this chronic pain cycle happens in which like you have pain, you try to seek out things such as like pain medications or like even injections, a lot of these different things that are more invasive. And what ends up happening is your body can actually, it can actually negatively adapt to that, in which your pain tolerance lowers because you've gotten used to these different types of pain meds, right? So you think you have a high pain tolerance, but really your pain tolerance is actually lowered. And so a lot of times this is how people go through this chronic pain cycle and they don't know a solution. So hopefully me and Dr. Joe are gonna enlighten you on some of the things that you can do today in order to prolong your life and improve your quality of life.
Yeah, absolutely. That's one of our main goals, is to help people improve their quality of life.
Yep, awesome. So Joe, so like what, there's a lot of people that sit at the desk, and we kind of know this thing, and people maybe have looked at it on Google or YouTube, and it's called upper cross syndrome. And we want to know how that kind of relates to upper body pain. So you mind explaining a little bit of that?
Sure. So one of the classic look of upper cross syndrome is if you look at somebody from the side and the shoulders go forward and then the head goes forward. That's the classic look of it. And that's a chronic position. And so what happens is there's an imbalance in the musculoskeletal system. And what happens is the pec muscles, they get shortened and they bring these shoulders forward. And with that, the rhomboids, the mid to lower traps, they become weakened because those are the muscles that hold the shoulder blades back and together. So that happens. And then the next thing is the head is going to follow whatever the shoulders do. Your shoulders go forward, the head goes forward. Especially again, if you're looking at your technology, you're down like this chronically, constantly. these muscles, they change over time, and this becomes a new normal for you. So the shoulders move forward and then the head moves forward. And what happens with that is the front of the neck kind of elongates a little bit. And you have some muscles deep inside your neck, underneath or behind your throat, right in front of your spine. Those are called the deep neck flexors. Mm-hmm. And again, because this becomes a little bit more elongated, these muscles become weak. And then the muscles right here at the base of the skull and top of the neck, they become shortened and tight. So you have this tightness here and tightness here, and then weakness here and weakness in the back. And that's why we call it upper cross syndrome. So we do see a lot of patients who have this upper cross syndrome that then these musculoskeletal imbalances then lead to pain later. For people who have this upper cross syndrome, and it does lead to an upper back and neck pain type syndrome, what can this upper back and neck pain lead to down the line if it's not taken care of in the beginning?
Well, along with the things that you just said, so some people can have neck and upper back pain, and a lot of people just straight up tolerate it, right? But over time, it can lead to a lot of different things. For example, there's a lot of research out there that neck pain is correlated with eye fatigue, right? So a lot of times, if your screen's not bright enough, or let's say the words are really small, for one thing, it can actually make you squint and it can put you into that forward head posture. So that's one thing. And there's a lot of correlation with like the eye muscles and how it correlates with neck pain, and how, when you're kind of straining your eyes, your neck has to work extra hard in order to stabilize your neck in that position. So that can actually lead to unwanted tension in the neck, the upper back, the shoulders. And that's one thing. Other things that can happen are, over time, it can lead to jaw pain. So if you have any like TMJ type pain, that can strictly be mechanical, in which the TMJ, as you're forward, it actually rocks the jaw kind of forward and down. And what that can do is it can lead to unwanted jaw pain. So you start to have some pain with like opening your jaw or eating things that are hard. But it can also just be referred pain, because jaw pain, believe it or not, a lot of the muscles and a lot of the sensation from your jaw actually comes from the same nerve roots as your cervical spine, right? So like, for example, like C1 to C4, like the first 4 cervical nerve roots, that contributes to, the sensation on your skin as far as like your head, your nose, as well as your jaw, right? So this would be like C3, C2, C1. So those rough areas, so if you're having any pain that's like in the eyeball area, or pain in your head, or even pain along the jaw, that could be a mechanical TMJ issue, but it can also be referred pain that actually goes into the jaw. And so we don't want to go too much into detail about the many things that can happen about neck and upper back pain, but what it does show is that me and Dr. Joe are very keen on helping people with their posture and strengthening the right muscles, correcting these imbalances, making sure that these other issues besides neck and upper back pain doesn't turn into these other issues that can affect you down the line. And overall, the last thing that you want is for your quality of life to decrease, for you to come home and be very tired, and to not have that time for your family, to have your quality of life just decrease. And so we're going to go through a couple different tools and exercises, so that these chronic issues don't become something even worse later on down the road. And so, I wanted to ask Dr. Joe, like, what kind of tools or stuff do you recommend people using at home in order to ease pain today?
Yeah, so obviously we're going to get into a little bit of those exercises that people do at home, but some of the things that people can use, just starting today to get immediate relief. We recommend TENS unit for chronic pain. That helps to reduce pain and manage those nerve fibers and those pain fibers. Of course, heat and ice as well. A lot of people ask, is heat better, is ice better? What it really comes down to is, what does that patient like better? What do they feel works better for them, and continue with that. I have patients who come in and they don't really like heat. They like ice better, which is rare, I think. But if you like ice better than heat, use it. If heat works better for you, use it. Some of the other things also that people can use for self-myofascial release to help loosen up those tense muscles, lacrosse balls, golf balls, foam rollers, even some of the percussion type guns. There's a lot of brands out there now There's Theracanes where you have a little cane with the ball on it that you can put behind your back and really work those knots out. You can take an Epsom salt bath. Magnesium works to relax the muscle. You can even take a magnesium supplement. It works well to help relax your body. And of course, magnesium Epsom salt bath, that warm bath really helps you to relax as well. Of course, there's other things like pain creams, BioFreeze. We use that a lot. There's plenty of options as far as that's concerned. But those are the things that people can use starting today to help alleviate some of those symptoms. Not going to correct the problem, but it'll certainly help alleviate some of those symptoms.
Right.
So yeah, as I was mentioning before, we're going to get into some of these exercises that's really going to help to correct a lot of these problems that people have. And, going from the head and neck down, what do you find, or what do you prescribe to some of your patients for some of those exercises that people can start doing to relieve some of that neck pain?
Yeah, so there are just, I think me and Joe, we've been doing this for a while, so there are a million exercises you can do, right? And it's really important that if you are having any of these neck and upper back issues, we post stuff on Instagram all the time, but definitely if you wanted to have us assess you, and you're in the area for where Dr. Joe is, you want to make sure that you're getting this appropriately assessed, so you're not just shooting in the dark with different exercises. But we do want to enlighten you on showing you certain exercises. What I'll be going over is a couple different stretches, specifically pertaining to the neck region. And then Dr. Joe can actually go through a couple different things that pertain to postural, and some things that are kind of like below the neck. So let's just talk about just general range of motion exercises. Anybody that has chronic pain, you just want to understand first the 6 cardinal motions that the neck and the rest of the spine can do, right? So there is flexion, looking down. There's extension, looking up, right? There's right rotation, okay? There's left rotation. And then there is right side bend and a left side bend, right? So just understanding those 6 cardinal motions, you just got to feel out like what sort of things are actually feeling good, right? Does it feel good to stretch my neck to the left? Does it feel good to pull my neck, to the left and stretch out some of the right muscles? And you have to, it's just like ice and heat. A lot of times you just have to find what works well for you. And if you need it appropriately assessed, you can go to Dr. J and Dr. Joe, right? And then we can assess that for you. Couple different stretches. So I want to address some of the muscles that pertain to the neck, right? So we have the upper trap that attaches from the scapula, the shoulder blade, and attaches into basically the upper neck. And it's a really large muscle for some people. And a lot of times people can get knots here. So in order to stretch that out, it's straight up just a side bend. So without any rotation, it's just bringing your left ear towards your left shoulder without any sort of rotation. And you can actually apply some overpressure and pull that down. And you can actually apply that for anywhere between 10 to 30 seconds, whatever feels good to you. You can apply that to the other side. Again, some overpressure. If you wanted to actually hold on to, for example, a weight, or you can grab onto the back of the bottom of the chair, you can actually pin your other arm down and actually stretch it this way, right? Not the best camera angles, I do apologize for that. A couple other things you can do are like stretching the levator. So that's the muscles that attach from your upper cervical spine. And how you stretch that out, it's a little bit of side bend and a little bit of rotation, either sometimes away from the left side or sometimes rotate towards. Now there's some debate on like how to stretch it, but I find that, rotating towards that side and then away actually feels pretty good, and you can pull. And then the last thing I want to go over is just the scalenes too. The scalenes attached to your upper rib cage and attaches directly into the neck. So a lot of times what I'll do is I'll do a pin and stretch where I'll grab my clavicle or I'll grab my collarbone. I'll pin some of the muscles down right on the right side of my neck. And then I'll bring my neck up and away from the hand. And what that's going to do is going to stretch some of the scalenes. So the scalene muscles are attached right in the front. A lot of times if you have numbness in your hands, it's possible that doing a scalene stretch can actually help that, right? And it's just a pin and stretch. You can release, or you can do it without your hands. It's a little bit more gentle without the hands. And so those are a couple different stretches you can do. And isometrics are another thing you can do. Isometrics basically strengthening the neck, kind of like applying pressures to the neck without basically any motion, right? So isometric is a type of contraction of any muscle. So I'll give you an example. If I just try to keep my head straight and then somebody tells me don't move, I can apply a stress to the right side of my neck, and I'm applying that in order to strengthen or actually alleviate pain on the right side of my neck. So if I'm pushing on the right side, you know, you're tensing up the muscles on the right. You can apply that for like anywhere between a 10 to 30-second hold. And you can apply that on this side. You can even apply it in the front and even in the back, or even different angles, just depending on what sort of muscles you're trying to strengthen. And you're not really working on strengthening. It's more like if you hold it for 10 to 35 seconds, that's actually been shown to reduce pain. And then the last thing I want to go over, because I want Dr. Joe to have some commentary on this too, is just the chin tucks, which he told you that when you're here, a lot of times you lengthen the front side of the neck. So what you want to think about is tongue on the roof of your mouth, you know, right below your teeth. Keep your lips closed, but don't clench your teeth, which can activate the jaw muscles. And you're just going to pull your chin towards your Adam's apple. So I'll do it from a front view. So here, kind of like double chin look, and as well as like the side view. So tongue at the roof of your mouth, keep your lips closed, and then apply the chin towards your Adam's apple, okay? And you can also imagine like a string being pulled up from the top of your head, and you can reverse that. So essentially you're reversing some of this forward head position, especially if this position is sensitive. You wanna go into this position, you know, I would say maybe 10 times every couple hours. I think there's different strategies that Dr. Joe might employ. Some people have like 10 repetitions, 10-second holds, but it's whatever kind of feels the best for you. And yeah, so that was a mouthful. Hopefully that gave people a lot of different exercises they can do. But yeah, tell me, Dr. Joe, like how and why, you know, should people strengthen the muscles also like in the thoracic spine, the scapula, and why is that important? Maybe you can actually show us a couple exercises too.
Sure. Yeah, as we talked about earlier with that upper cross syndrome and the shoulders going forward, the pecs being tight, the mid to lower traps becoming weak over time. Part of that, again, is because the pecs pull the shoulders forward. So the first thing you want to do is start to open up this chest again so that the head and chest come back. You want to stretch the pecs. Best way to do that, you can get on a door frame, put your hand on the door frame here like this, and we'll keep our chest, shoulders, and everything square. We'll step forward so that you feel a stretch here in the front of the chest. You can do this at several different angles. Up here, you can do it with your elbow bent. I personally like the elbow out a little bit more. We'll step forward and we'll hold that again, like you said, about 10 to 30 seconds. That's going to help open this up. Now, you also have to strengthen the muscles in the back to help keep that back. Again, we have the mid traps, the lower traps, and the rhomboids that tend to become weak in that area. If you think about your shoulder blades here like this on your back, if I was facing the other direction and you were looking at my shoulder blades, what we see with upper cross syndrome is those shoulders come up and forward. So we want to train them to come back and together. So everything we do, we want to squeeze them back and down, almost as if you were going to try to take your elbows and touch them together behind your back, almost at your waistline. Mm-hmm. So you can do this with bands, but we can just do regular scapular retractions where we're going to pull back, squeeze the shoulder blades back and down, and then back forward. You can do this exercise in the gym. You don't even need anything. I can do it 100 times just like this without any resistance bands, and I'm going to get a good contraction there. Another one, you can do this laying down or with bands as well. We call it the TY and I. This is a T, so if you're here, my arms are straight out, you're going to squeeze those shoulder blades back and together, and then here. And then we have a Y, again, squeeze. I'm solely focusing on my shoulder blades, not my arms. Yeah, they're up here, but I want to squeeze down and together. And then the eye, again, the eye is a little bit more difficult, but a very good exercise. And then another exercise that we show a lot for many different reasons, spinal mobility, but the cat-cow is good for everything from the neck to thoracic to lumbar in so many different conditions, but it's just good to mobilize your spine. I'll actually just feature a video that we've done here before with the cat-cow. But it's good for flexion and extension of the whole spine. The more mobility your spine has, the healthier your spine and the surrounding muscles will be. So that's a great exercise as well.
Absolutely, absolutely. Yeah, just to harp on that, I mean, like, yeah, there's, me and Dr. Joe, we can't go through every single exercise, known to man, but I think a lot of the things that we just harped on, as far as like the neck exercises and things that pertain to your strengthening your posture, banded exercises. I mean, there's just so many things you can do. But definitely, if you're, confused and you're wondering like which exercise are best for you, definitely get it assessed, right? There's, you don't want to. I think I say assess, don't guess, right? So making sure that you're not just doing randomized exercises. Granted, if you find something that works for you, just keep doing it.
Right. So again, we talked a little bit earlier about where people can find us, because we actually met through Instagram. So you have a great account, and I like to think that we have a good one going as well.
Obviously.
What's your Instagram handle again?
Yeah, so my Instagram handle is Flex with Dr. J, so FLEXWITH, and then the full word Doctor, DOCTORJAY. And yeah, you guys can feel free to message me. I definitely have a lot of free resources in my bio, and you can check out some of those things there, specifically to neck and upper back pain. And yeah, so where can they find you as well, Dr. Joe?
Yeah, I'm on Instagram as well. I am at Select Body Doc. And my office is Select Spine and Sports Medicine. So that's kind of where that came from in the body. Obviously, work on the body. So at Select Body Doc, again, we have a ton of resources out there for different conditions. Again, if you are actually dealing with a painful condition and you feel stuck, you need to be evaluated. If you are in the Houston area, that's where I'm found. And I know Dr. J, you see patients online.